Hello, everybody out there. Welcome to General Toxicology Part 5, presented to you by the Indian Society of Toxicology. Today we will discuss a very important and at the same time, unfortunately, a highly misunderstood aspect of general toxicology, and that is antidotal therapy. We will talk about antidotes. There's a lot of information out there. Some of it sensible, some of it, I'm afraid, close to being nonsense. We'll look at all that and present to you objectively what exactly is the meaning of antidotal therapy. What are antidotes? What are the recommended antidotes today? And how they should be employed. We will also look at some of those antidotes which are either outdated or considered hazardous and not recommended anymore. Let us begin with the first and foremost aspect about antidotes, and that is, of course, the definition of an antidote. Very simple, very commonly asked in the examination if you are appearing for toxicology as a medical student or forensic student, whatever. Definition is just virtually one line. An antidote is a substance that counteracts the effects of a poison. How do you like that? So simple. And when you come to the next part, and that is, are there really antidotes for most of the poisons out there? Because that's a common misconception, that we have specific kinds of treatment for almost every poisoning, and many a time there are antidotes available for common poisons. Not true. Look at the statistics. Just about 5% or less of the commonly encountered poisons you have antidotes. So antidotal therapy is not really a magic bullet for every case of poisoning. In fact, most cases you can manage perfectly well with symptomatic and supportive measures. All that you require is correct diagnosis and early treatment. Now the question arises, there is this term universal antidote. It is there in many of the textbooks, and many teachers, while lecturing on toxicology, touch upon this. So sad, because let's look at what exactly universal antidote is all about and what is it standing today. It sounds so attractive, isn't it? Universal. That means it is an antidote that will be helpful for all kinds of poisons. All kinds of poisoning cases, we have really something like a magic bullet. Of course, it's a myth. And first we will look at what exactly is the meaning of antidote before condemning it. It is a mixture of 2 parts activated charcoal. That sounds okay. 1 part tannic acid does not sound okay. And 1 part magnesium oxide. The whole thing is a very strange concoction indeed. And some of the books go so far as to say if these chemicals are not available, you can even use substitutes like this. Can you believe? 2 parts burnt toast, 1 part strong tea, 1 part milk of magnesia. Mix everything together, give it to a poison victim. It's effective against every poison. Really? I'm afraid I have to say outright that this is nothing but nonsense. It's a useless concoction. There is no such thing as a universal antidote. Doesn't exist. The only component of this mixture is activated charcoal, which in fact is more effective if you administer it alone and don't mix it with the other things that I listed just now. This so-called concept of universal antidote went out of toxicology textbooks in the West from the 1970s onwards. Can you believe that? And yet persists with great tenacity in some of our Indian textbooks. And questions on universal antidote are asked in the examinations. This is a shame, because what we should be doing with outdated information like this is just throw it out of the window. And that is where universal antidote belongs. Outside the lecture hall, outside every book on toxicology. Having said that, let us now look at genuine antidotes and how they are classified. So the classification will depend on the mode of action of an antidote. We have the following modes of action. Number one, inert complex formation. The antidote forms an inert complex after combining with a poison, which is excreted harmlessly. You need to have some examples. Best examples of antidotes which act by this mechanism, that is inert complex formation, are number one, chelating agents for heavy metals. You have a number of them. We'll come to the details later. But right out I can tell you, for instance, you have calcium disodium edetate, desferrioxamine, cupramine or penicillamine for various heavy metals. All these act by the same method. Then you have what is called Prussian blue for thallium, another heavy metal, but it's a very dangerous heavy metal indeed, and has been used in several cases of sensational homicides and attempted homicides. So we will talk in detail when we come to heavy metals on all examples, including thallium, which is very important and unfortunately not stressed upon much in our medical curriculum. Prussian blue is not Russian blue. There is a P there before the R. And it actually is potassium ferric hexacyanoferrate. But even if you don't remember that, that's fine. Just remember the name Prussian blue. For cyanide, you have a number of antidotes. Dicobalt edetate acts by inert complex formation. With regard to the other antidotes, we'll come to them shortly. Then you have this method, accelerated detoxification. Much of this kind of classification is self-explanatory, isn't it? When you say accelerated detoxification, obviously the antidote will accelerate the detoxification of the poison. All you need to know is the terminology and the examples. So with regard to the examples, there are some very, very important examples indeed, including one of the most important antidotes of cyanide, much more than dicobalt edetate, and that's sodium thiosulfate, which accelerates conversion of cyanide to non-toxic thiocyanate in the presence of an enzyme called rhodonase, which is present in our body. Then you have the very famous antidote for paracetamol, which is of course also called acetaminophen. The antidote is N-acetylcysteine, or often abbreviated to NAC. Extremely, extremely important to remember. Very commonly employed in paracetamol overdose. Very effective. Then we come to reduced toxic conversion. Another category where the antidote reduces the toxicity of a poison by converting it to a less toxic or sometimes relatively non-toxic form. Again, you need to remember the important examples. There is basically one very important example, which I would say is the best example, and that is ethanol. For methanol, we all know ethanol is not very toxic unless, of course, somebody imbibes excessively or for a prolonged period of time. Whereas methanol is a toxic alcohol. Even a small quantity, one sitting, can cause serious problems, including, visual loss, metabolic acidosis, renal failure, all kinds of issues, and of course also fatalities. Ethanol acts by inhibiting the metabolism of methanol by competing for the same enzyme, alcohol dehydrogenase, because methanol per se is not really all that toxic. It is the metabolites which are toxic. I'm sure some of you know that. The important metabolites being formaldehyde and formic acid. Alright, coming to the next category, that is receptor site competition. Very effective. An antidote that displaces a poison from specific receptor sites. And the best example that I can give you for this category is, of course, naloxone, which displaces opiates or opioids from specific receptor sites. A very important antidote, commonly employed and quite effective. Coming to a related kind of mechanism, that is the receptor site blockade, which is a category of antidote that blocks the poison from specific receptor sites. And again, you have one very important example, the best example, and that is, of course, atropine. For all anticholinesterase agents such as organophosphorus insecticides, often abbreviated to just organophosphates, and atropine acts at muscarinic receptor sites. Very effective antidote. Then we move on to the last category, that is toxic effect bypass. And as the name itself suggests, the antidote exerts its effects by helping to bypass the toxicity of the poison. It's not really direct kind of effect. And the best example that I can give you is oxygen for a poison like cyanide. Though it is not really a specific antidote, it is a very important adjunctival antidote. So there you have it. These are the 6 categories of antidotes. This is the latest classification. There are, I know, books which give a different kind of classification that I'm afraid is a little outdated, where you classify it as physical, chemical, mechanical, physiological. Please remember, today's classification is these 6 categories, which give you all the important examples of antidotes. Now we will look at the list of, first of all, true antidotes, and that too specific antidotes. Because there is a second category of true antidotes called adjunctival antidotes. We'll come to that later. When you say specific, the antidote is specific for one poison mainly, or maybe one category of poisons. Like, for instance, this N-acetylcysteine for paracetamol. I told you that paracetamol is also referred to as acetaminophen, so don't get confused. N-acetylcysteine is among the best antidotes and works very well for paracetamol. You have a number of antidotes of cyanide, including nitrites like amyl nitrite, sodium nitrite, and of course you also have sodium thiosulfate, which we talked about just now, so also dicobalt, edetate. You also have antidotes like dimethyl aminophenol and hydroxycobalamin. So number of antidotes, but the most important ones are the nitrites, that is amyl and sodium nitrite and sodium thiosulfate, all of which usually are given rapidly one after the other. We'll discuss the details when we look up cyanide poisoning. Then we come to datura, which also has an excellent antidote, physostigmine. Datura is a plant which is commonly seen in India, all over the country. It's a wild plant, grows in the countryside, and it has got a number of very powerful alkaloids, especially in the seeds, like atropine, scopolamine, etc. And they are anticholinergic in effect, so you have to give a cholinergic drug, and the best drug is physostigmine. Even then, caution is necessary, because physostigmine, though effective, is a dangerous drug and can cause death unless you are careful. Then of course we have the organophosphorus and carbamate insecticides, often just abbreviated organophosphates and carbamates. 2 excellent antidotes, atropine, which we have already talked about, and the other is oximes. There are several oximes. In India we use what is called pralidoxime. You will notice on the slide that oximes have given a different color. This is because actually oximes are not essential for carbamates. And even with regard to organophosphates, there's a bit of controversy. We'll discuss all those details later. But the current practice is still to give both atropine and oximes for organophosphorus insecticides, and for carbamates you need to give only atropine. For oxalic acid and all oxalates, there's an excellent antidote called calcium gluconate. You can also give calcium chloride instead, but it is usually calcium gluconate which is advised and pretty effective. For iron, there is a chelating agent called desferrioxamine, sometimes shortened to deferoxamine. Arsenic, you have this British anti-Lewisite, often abbreviated to BAL, also called dimercaprol, quite effective. And for lead, you have calcium disodium versate, also called calcium disodium editate or calcium disodium EDTA. Details, as I said, will come to when we discuss these individual poisons later. Continuing with this list of specific antidotes, for copper we have another chelating agent, and that is penicillamine, also called cupramine, very specific for that particular metal. For diazepam, you have flumazenil, which is also effective for many other benzodiazepines, but is very effective especially for the first generation benzodiazepines like diazepam. Ethanol, I have already talked about as one of the antidotes for methanol, but you have of late another even more effective or efficacious antidote called formipizole, which is actually 4-methylpyrazole. For beta blockers, glucagon. For insulin, of course, glucose. Opiates, we have touched upon naloxone. There's also one more newer antidote called namifene. Naltrexone is really not ideal for acute opiate overdose. It's more preferred for chronic kind of addictions. We'll come to the details again later. With regard to this, anti-TB drug isoniazid, vitamin B6 or pyridoxine is a very effective antidote. Thallium, I've already touched upon this. Prussian blue, which is actually potassium ferric hexacyanoferrate. Warfarin, vitamin K, especially vitamin K1, which is called phytomenadione. For heparin, protamine sulfate. Please do remember these antidotes. Extremely important, very commonly asked, and many of them are very commonly employed in practice. The slide now that I'm displaying is about adjunctival antidotes. They are also genuine antidotes, they are also true antidotes, but they're not specific for a particular poison or category of poisons. As you can see here from the examples, like for instance, activated charcoal. It is effective for most poisons. We have discussed in detail, I think in episode number 4. Mostly alkaloids and several others, except for AHA, that is the mnemonic I gave you. That is acids, heavy metals and alcohols. Activated charcoal is not all that effective for almost most other poisons. It is a very effective adjunctival antidote. Then you have flumazenil for actually diazepam and benzodiazepines. For convulsant poisons, we are supposed to give the benzodiazepine itself, that is diazepam. For poisons causing anaphylaxis, adrenaline of course. Those which cause psychosis or agitation, there is haloperidol. Those poisons which cause methemoglobinemia, we give methylene blue. Those which cause metabolic acidosis, we give sodium bicarbonate. For those which cause bronchoconstriction, of course, we give salbutamol, or it's also called albuterol. These are all adjunctival antidotes, and it is not for any specific poisons. It's for a particular, category, broad category of poisons which cause similar kinds of manifestations. We have to wind up with this list also, a list which you should just read and forget. Obsolete or outdated antidotes. You have the examples listed here. Methionine and cysteamine were once recommended for paracetamol, not anymore. Now it's only N-acetylcysteine. Methylene blue was recommended for cyanide. Today it is only for poisons which produce methemoglobinemia. Neostigmine and pilocarpine should not be given for datura. You have a much better antidote, that is physostigmine. Oximes are not recommended for carbamates. What we use in India is pyrrolidoxime. that is given for organophosphorus compounds. Milk of magnesia soap solution, some textbooks mention this, for acid intake, acid ingestion, not at all, absolutely contraindicated. Starch for iodine, no, not to be given. There are books which mention milk and raw egg, can you believe it, for heavy metals? Absolute rubbish. Then you have, neutralization of alkalis with vinegar, orange juice, lemon juice. These are all to be condemned, not to be used. Then there are some outdated antidotes for opiates like nalorphine and levolorphan. They also should not be used. Continuing with the list of obsolete antidotes, you have, for instance, copper sulfate for phosphorus. That is mentioned in some books. Again, not recommended today. Copper sulfate is a very dangerous chemical, and you may sometimes aggravate phosphorus poisoning by giving copper sulfate instead of ameliorating it. Then there is some antidote called diethyl dithiocarbamate, kind of tongue twister for thallium, not recommended. For thallium, Prussian blue is perfectly okay. Fructose was once upon a time recommended for ethanol, not anymore. Then there is something called silibinin for amanitin, a kind of toxin present in some mushrooms. And finally, for a very dangerous pesticide called paraquat, which is a herbicide actually, very lethal, tocopherol is sometimes recommended, which is again not effective and not to be administered. This list also is important, not for remembering, but actually for forgetting. That is the so-called outdated antidotes or obsolete antidotes. I hope that I've been able to give you some sort of an insight into antidotal therapy. Do go through the slides and the presentation once again, because it's always advisable. Antidotes are extremely important, even though they are not available for most poisons. Some of the poisons where antidotes are available can be very well managed with these agents. So, goodbye, and remember, when you think of antidotes, think of true antidotes, whether specific or adjunctival, and forget the rest. We will continue with part 6 of general toxicology next time. That will be the concluding session. Don't miss it. It's about duties of doctors in a case of poisoning. Again, a lot of controversy is there. We'll try and resolve those in that particular episode. Goodbye.